Did you know that something as simple as your toothbrush or bathing schedule might be warning you or your doctor of a life-threatening condition? It may sound shocking, but physicians can often detect serious internal health problems just by observing a few subtle hygiene habits. These aren't just signs of aging. They are red flags your body might be waving, hoping you'll notice. And the truly alarming part: most seniors and their loved ones have no idea. Every day, small hygiene mistakes are made with the best of intentions. Yet they can hide or even cause dangerous conditions that slowly steal independence, dignity, and health. In the next few minutes, you're going to learn the 7 most critical personal hygiene mistakes doctors notice in older adults. These aren't cosmetic concerns. These are life-saving clues. And more importantly, you'll learn exactly how to fix them starting today. Let me introduce you to Harold, a retired engineer, 75 years old, still swinging a golf club twice a week, cheering on his grandkids at every ball game. To everyone, Harold looked like a man in control of his golden years. But during what seemed like a routine checkup, his doctor noticed 3 hygiene red flags right away. They were things Harold had overlooked, habits he thought were harmless. What the doctor saw told a different story. Behind the clean shirt and friendly smile, Harold was showing signs of a dangerous condition developing silently for months. Harold later told me, "I had no idea. I thought I was doing everything right. But if my doctor hadn't noticed those tiny things, I might not be here to tell this story." Today, I'm going to tell you exactly what those mistakes were, so you can protect yourself or someone you love. Because these aren't just warnings, they are opportunities. Opportunities to take control of your health, maintain your freedom, and potentially add years to your life. Let's begin with one you probably haven't thought about recently but should. Mistake 1: neglecting oral hygiene. When was the last time you really looked at your toothbrush? Is it frayed? Worn out? Are you brushing twice a day, every day? More importantly, do you know what's actually at stake if you aren't? This goes far beyond bad breath or losing a tooth. According to geriatric specialists at Harvard Medical School, poor dental hygiene in older adults is directly linked to heart disease, stroke, and even dementia. Yes, bacteria from gum disease can slip into your bloodstream and trigger dangerous inflammation in your heart and brain. In fact, seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems. Let that sink in, 3 times more likely. And this isn't just theory. Let me tell you about Sylvia, a 68-year-old retired school teacher from Oregon. Smart, diligent, but she ignored her bleeding gums for months. "I just thought it was part of getting older," she said. But when she went in for a checkup, her cardiologist discovered something terrifying: inflammation in her heart valves caused by oral bacteria that had traveled through her body. Her doctor told her that if she had waited a few more months, the damage could have been irreversible. So what should you do? First, look at your toothbrush. If it's older than 3 months or the bristles look tired, replace it today. Better yet, switch to an electric toothbrush. Studies from the University of Pennsylvania's dental school show they remove 62% more plaque than manual brushing. Brush twice a day, every day, for a full 2 minutes each time. Set a timer if you need to. And floss every single night. No excuses. Even if you wear dentures, don't skip your checkups. And if you ever notice bleeding, swelling, or pain in your gums, don't brush it off. These are not just signs of aging. These are alarms. And your body is hoping you'll listen. How often are you bathing? Be honest with yourself. As we age, it's common to cut back on showering, especially when mobility gets harder or our skin feels dry. But here's what many people don't realize. Your skin isn't just a protective layer, it's your body's biggest warning system. Dermatologists at the Mayo Clinic have found that reduced bathing in seniors often masks early signs of diabetes, liver trouble, and heart problems. Skin issues often appear before any internal symptoms do. And when bathing frequency goes down, those visual clues get hidden. Their research shows nearly 40% of undiagnosed health conditions in seniors could have been spotted sooner through proper skin observation. Let's talk about Clarence. He's a 77-year-old retired postal worker from Michigan. Clarence figured once a week was enough, especially in the winter. I didn't want to dry out my skin, he said. But during a visit for a totally unrelated issue, his doctor noticed a subtle skin discoloration. Further testing revealed early-stage kidney disease. The bathing itself wasn't the issue, it was the lack of observation. His weekly routine was hiding critical signs. What can you do? First, set a regular bathing schedule, ideally 3 times a week or more. Even if you're not breaking a sweat. Use a gentle, fragrance-free soap to protect your skin's natural oils. After each bath or shower, apply a good moisturizer while your skin is still slightly damp. That locks in hydration and keeps your skin healthy. And perhaps most importantly, look. Really look. Examine your skin regularly. Are you noticing flaky patches, discoloration, areas that itch or feel different? These aren't just cosmetic annoyances. They could be your body's first whisper of something serious. Next up, take a look at your hands. Or better yet, your feet. Because your nails might be showing you more than you think. Take a moment. Look at your fingernails and toenails. Are they neatly trimmed? Clean underneath? Do they have an even color and thickness? You might be surprised to learn this. Your nails are one of the first places doctors look when evaluating a senior's overall health. According to the American Academy of Dermatology, nail abnormalities can signal more than 20 internal illnesses, from anemia and thyroid disorders to heart disease. Their studies revealed something incredible in patients over 65. Nail changes helped lead to the discovery of previously undiagnosed medical conditions in nearly 30% of cases. That's right, something as small as a yellowed toenail could be the clue to a much bigger health issue. Let me tell you about Beatrice. At 82, she noticed her toenails were thick and yellowing. Embarrassed, she simply stopped wearing sandals. I figured it was just part of getting older, she said. But when foot pain finally took her to a podiatrist, the doctor didn't just see a fungal infection. He saw evidence of a severely suppressed immune system. That simple foot exam led to a life-saving diagnosis and treatment for a condition she didn't even know she had. Here's what you should do today. Trim your nails regularly, straight across, and round the edges slightly to prevent ingrown nails. Keep your nails clean and dry. Change your socks daily and wear breathable shoes. And don't ignore changes, brittleness, discoloration, thickening. These aren't beauty concerns. They are red flags. Your nails are trying to speak to you. Are you listening? This next mistake might be the most hidden and the most heartbreaking. Because while over 50% of seniors experience some form of incontinence, the vast majority try to hide it. Out of embarrassment. Out of pride. And in doing so, they often put themselves at serious risk. Urologists at Johns Hopkins report that untreated incontinence can lead to skin infections, dangerous falls, social withdrawal, and can even hide signs of bladder or prostate cancer. And here's the key: seniors who actively manage incontinence have 60% fewer health complications than those who don't. Let's talk about Douglas, a 73-year-old retired accountant from Arizona. He noticed occasional leakage but didn't tell anyone. He used paper towels. He changed his clothes more often. He thought he was handling it. But then the skin irritation turned into painful sores. When he finally saw a doctor, they discovered an advanced prostate condition that could have been treated months earlier if only it had been caught in time. My pride nearly cost me my life, Douglas told me. I wish I'd spoken up sooner. Here's what you need to know: incontinence is not a normal part of aging. It's a symptom. And it needs to be addressed, not hidden. If you're experiencing leakage or urgency, speak to your doctor. They see this every single day. Use real incontinence products, not paper towels or makeshift solutions. Change promptly when needed. Cleanse gently and thoroughly to prevent skin breakdown. And never feel ashamed. Talking about it could be the step that saves your life. Next, let's move on to a hygiene mistake that's as common as it is dangerous, and many don't realize the damage until it's too late. How do you clean your ears? If you're like most people, especially from older generations, you probably use cotton swabs. Maybe you've been doing it for decades. But did you know that inserting cotton swabs into your ears is one of the most dangerous hygiene habits? Otolaryngologists, ear, nose, and throat specialists have found that improper ear cleaning causes nearly 40% of ear canal injuries in people over 65. These injuries often lead to infections that could have been completely avoided. Let me introduce you to Patricia. She's a 71-year-old retired librarian from Washington. Patricia cleaned deep inside her ears regularly with cotton swabs until one day she pushed too far. She punctured her eardrum. The infection that followed spread to nearby tissue, causing hearing loss. I had no idea, she said. No one ever told me it was dangerous. So let's clear this up once and for all. Never insert anything smaller than your elbow into your ear canal. That means no cotton swabs, no hairpins, no makeshift tools. To clean your ears safely, use a warm, damp washcloth to gently wipe the outer ear. If you suspect wax buildup, use over-the-counter drops specifically designed to soften it. But always follow the instructions. And if you experience pain, discharge, or hearing changes, see a doctor immediately. Are your ears itchy? Do they feel full or blocked? Are you noticing changes in your hearing? Don't try to fix it yourself. Your hearing is precious, and it's worth protecting, starting today. When was the last time you really looked at your feet? Not just glanced at them, but truly inspected the skin between your toes, your heels, your soles. You might be surprised to learn that your feet are often the first place doctors look for signs of serious internal problems. According to the American Podiatric Medical Association, foot hygiene issues often reveal early warnings of diabetes, nerve damage, and circulatory disease. And here's a staggering fact: in patients over 65, up to 85% of diabetes-related amputations could be prevented with proper foot care and early detection. That's right, 85%. Take Raymond, a 76-year-old retired factory worker from Illinois. For years, he ignored the dryness and small cuts on his feet. They just looked old, he admitted. I figured that's what happened with age. But during a routine physical, his doctor examined his feet and immediately ordered blood tests. Raymond was in the early stages of diabetes, and because they caught it early, lifestyle changes made a huge difference. If my doctor hadn't looked, he told me, I might have gone years without knowing. So, what can you do today? Wash your feet daily. Dry them thoroughly, especially between the toes where fungus loves to grow. Inspect them for cuts, sores, or discoloration. Are there any areas that feel colder, numb, painful? These aren't just signs of aging, they are urgent messages from your body. Wear clean, dry socks made of breathable or moisture-wicking material. Apply moisturizer to dry areas, but skip between the toes. And never ignore wounds that won't heal. Strange tingling or changes in skin color. These are not cosmetic concerns. They are health alarms. And they could be giving you the head start you need to prevent something far worse. Now let's look at a hygiene mistake that often flies completely under the radar because it's not something you're doing wrong. It's something your medication might be doing to you. Are you taking multiple medications? Have you noticed a change in your body odor? Unusual sweating or dry mouth since starting them? You're not imagining things. And it's not just aging. Pharmacologists from the American Geriatric Society have documented that many common medications cause hygiene-related side effects like dry mouth, changes in body odor, or excessive sweating. And here's the truly critical part. These signs can be early indicators of drug toxicity or dangerous reactions. Nearly 40% of adverse drug events in seniors first appear as hygiene-related changes before any other symptoms show up. Let me tell you about Barbara, a 67-year-old retired nurse from Florida. Barbara's family noticed a strange change in her body odor. They gently hinted at it, thinking maybe she needed to bathe more often. But Barbara was already showering daily and using deodorant. It wasn't poor hygiene, it was her body speaking through scent. Her doctor recognized the odor as a potential sign of liver toxicity caused by her medication. Thanks to swift action, they adjusted her treatment before permanent damage occurred. So, what should you do? Track any hygiene changes that occur after starting or adjusting medication. Keep a simple journal. Are you sweating more? Does your mouth feel unusually dry? Are you noticing any changes in your scent that aren't solved by hygiene routines? Stay hydrated unless instructed otherwise by your doctor. And most importantly, report these changes. Don't assume they are minor. Don't guess. Never adjust or stop medication on your own. These signals could be your body's earliest plea for help. Your medications are meant to heal, not harm. But even healing tools need monitoring and being proactive about these hygiene shifts could save your health and your life. Now you know the 7 personal hygiene mistakes that could be silently warning you of life-threatening health issues. Each one may seem small on its own. A toothbrush past its prime. A skipped shower. A slightly thickened toenail. But as you've seen, these aren't just habits. They are clues. Clues that doctors use to detect what's happening inside your body before it's too late. By paying attention to your hygiene, you're doing more than staying clean. You're watching for early signs of heart disease, kidney failure, diabetes, even medication toxicity. You're giving yourself and your loved ones a chance to catch problems early, when they are easiest to treat. You've heard the stories. Harold, who thought he was fine until a doctor spotted what he couldn't see. Sylvia, who ignored her gums. Clarence, who missed the warning in his skin. Raymond, who assumed rough feet were normal. Each one of them was given a second chance. Not because they knew something was wrong, but because a small detail told a big truth. These small adjustments, better brushing, regular bathing, checking your nails and feet, managing incontinence openly, caring for your ears correctly, and watching for hygiene changes tied to medications, can protect your independence, your dignity, and potentially add years to your life. So here's the question, what will you do today? What's one small thing you'll change right now? Because the truth is, your body has been speaking. You just haven't known how to listen. Until now. If you found this information valuable, please hit the like button right now. Has your doctor ever noticed any of these hygiene issues? Share your experience in the comments below, we'd love to hear your story. Don't forget to subscribe and hit the notification bell so you never miss another piece of potentially life-saving health information. And please share this video with someone you love who's over 60. These simple changes could mean the difference between struggle and strength, between catching something early or too late. This knowledge could literally save a life.